So, tonight we're going to go over a bit of oxygen stuff. I can't remember if Sports Diver has any oxygen admin in it at all, but we're going to go into a little bit more detail on what we use oxygen for and why we'd use it. But before that, a little bit of a plug. For those of you who haven't seen this before, we use something called Easy Fundraising, which is a fundraising tool. But the theory behind it is that you sign up to it, log on, you can search for basically any retailer you want. They literally have a massive list that you'll see on the next slide. And then as you buy stuff from those retailers, they'll give free donations to our cause. So it's literally free money. There's a massive list of different companies that do it. There's different deals. So some companies will donate more, some companies slightly less. Over time, it really, really does build up, particularly stuff like comparing your insurance, comparing your phone contracts. If you switch energy supplier, that sort of stuff, that normally gives quite a big donation. And with the few people that we've had kind of test running this over the last couple of months, we've actually managed to raise over £200 so far for free. Like it's not cost anyone a single penny. So it's a really good thing that we could get involved with. And if we could get more people signed up to it, that'd be really good. So at the bottom of that slide, you can see there's a little link. We're just down as Luzak, so you know the name of the club. We'll also post links on the Facebook groups. So if you guys haven't signed up for that, please do. It's really useful. It doesn't cost you anything. It's not a pain in the arse. You can install a little plugin on your browser that pops up and reminds you to engage the donation. You literally just click a button and then that's it. Simple as that. So it's really easy to use, but it makes a big difference. So for us, that's 2 full sets of regulators. So if we manage to get more people on it, more time, we could potentially buy an entire new sets of regulators for free. So it's pretty good. So onto the shit you're here for. We're going to basically cover what the point of oxygen is, what situations you'd use it in, and why it helps in those situations. So certain conditions that you'd come across: decompression illness, burst lungs, near drowning, shock, carbon monoxide poisoning, and so on. We're going to go over the signs and symptoms of each of those conditions, and then we're going to go over the first aid procedures for those and why oxygen's going to be a huge benefit for us. The actual use of O2 equipment we're going to be taught in a later lesson and a practical session as well, which we're still working on rooms. But yeah, so what is oxygen? We actually have to teach you this. So characteristics of oxygen is it's colourless, odourless and tasteless. So it's essentially undetectable by humans. It generally comprises of about 21% of atmospheric air by volume. It's a totally essential component to our metabolism, and it's carried in the bloodstream by 2 different methods. The main method is by hemoglobin, so your red blood cells, and the secondary method is it's dissolved in the plasma in the blood. So the actual liquid that carries the hemoglobin is called plasma, and it's carried in that. And that's important because we'll come on to it in a little while. The plasma's capacity to actually transport that additional oxygen is then used in our rescue scenarios, which, like I said, we'll cover in a minute in a little bit more detail. Oxygen won't burn, but it does support the combustion of other materials. So if you have an oxygen-rich environment, potentially you could accelerate a burning flame. So it's something we'll have to consider as we're using the O2 kit. We'll go into a little bit more detail about this in the practical side of it. So first one, decompression illness. Causes of decompression illness. Can anyone give me the causes of decompression illness? You're all pretty much dive leaders now, so I'd hope at least someone could give me an idea. Dead silence. That's worrying. Go on, instructors. Come on, step up.
Get it when you go up too quick, can't you?
Okay. Yep. So
is expanding bubbles of nitrogen in your blood.
Absolutely. So inadequate elimination of the nitrogen from the body, which then causes bubbles in your blood. So I'll just get it all up so you can see. So there's 2 different main methods that these bubbles can cause damage. In the top part of the picture, you can see they're blocking blood flow. So then that's going to starve the tissue downstream of blood flow, which then causes damage. But you can also have bubbles form in the tissues next to the blood vessels, which further constricts the flow. Okay. So physical damage to your alveoli, the part in your lungs that actually transfers gas. If we're talking about burst lung, this is overpressure. It actually introduces bubbles of air into your blood, so it breaks that thin lining between your blood and the air sacs, and that can then introduce these little air bubbles that then go on to block flow. Now, this is important, as we mentioned before. The actual Abby's just joined, brilliant. It's important because you see on the bottom the blood vessel is constricted slightly. Now, it doesn't show it in the picture, which is a shame, but essentially these blood vessels are only just wide enough for a blood cell to travel down, and they transfer the oxygen to the tissues around them by scraping along the walls of the vessel, and that creates a diffusion gradient for the oxygen, which then diffuses into the tissue. So that's how they transfer the oxygen into the tissue. Now, if we constrict that blood vessel slightly, it's now too narrow for that blood cell to actually travel down. So unless the plasma that is the liquid that carries those blood cells can travel through that gap, you've entirely blocked off the oxygen circulation for anything past that point, which is why it's so important that plasma holds oxygen to a lesser degree than the cells, but it does hold the oxygen, and plasma can get through those constrictions a little bit better. Interesting point is PFOs. So it's a rare condition that you're born with, which is a hole in the heart. Generally, it's undetected until you have some kind of issue with it. The point is blood can then travel through the center wall in the heart, which bypasses the lungs. And typically the lungs act as a filter as such for these small bubbles, so they can prevent getting into vital organs like your brain. If you have this PFO condition, you have something called a cardiac shunt, which basically means your blood can bypass those lungs, so the small bubbles can get into vital organs such as your brain. So it makes you more predisposed to decompression illness. This does, because you will, I mean, to an extent, you will have a small amount of bubbles in your blood on every dive. That's just the nature of it, but they're not big enough to cause any issues. But with PFOs, that could actually become more of an issue. Okay, so what signs and symptoms do we have for decompression? What is the very first sign that you'd see someone with decompression illness displaying? Any guesses?
Confusion.
Confusion, yeah, maybe. The one that's sticking out that isn't technically a symptom is denial. So it's human nature to not want to believe that something bad's happened. So if you have someone with decompression illness, they'll absolutely categorically guarantee that they're fine. There's nothing wrong. They don't need to be airlifted off to hospital or anything like that. They'll be absolutely certain of it. So that's something that kind of raises a bit of a red flag when someone's certain like that, and it's something you have to realize that people are going to do. They'll tell you they're fine, even though they might not be. Another symptom is itches and rashes. So this is where you get a skin bend, where you have small bubbles that get or cause damage close to the surface of the skin, so it looks like a rash. These can be very faint all the way to incredibly severe. They can literally be anywhere on your body. There's no particular place that they're more susceptible or less. So if you see a rash that you don't normally get, so some people do get rashes from their undersuits, for example, but if you don't normally get a rash there, that's probably a bend. Now, some people might think that the skin rashes are fairly minor. Actually, they can be lethal. So if you do see one of these, don't just ignore it. A common one that people are taught is numbness, tingling, or joint pains. Joints tend to concentrate the bubbles, and so you'll tend to get pain in your joints more than anywhere else. That's quite a good option. People will put that down to kind of, oh, I've just pulled my muscles and that sort of stuff. So that's another thing that links back to denial. Visual disturbances. Why would we have vision disturbances with decompression illness? Where would that come from? Any ideas? So what controls your vision? Is it your brain? So if we have vision disturbances, what could be happening to our brain?
Not getting enough oxygen.
Not getting enough oxygen. Thank you, Joel. So if you have restricted blood flow to your organs that control your vision, so eyes, brain, all that sort of stuff, you could get visual disturbances. So that could be patterns, that could be full-on hallucinations, that could be all sorts of different stuff. So if someone's describing that, that could be your decompression illness. On top of that, dizziness, nausea, headaches, confusion, that's all related to your brain. And then in an even more severe case, paralysis, weakness, loss of bladder, bowel control, that's kind of stemming back to the brain because that's all controlled by your brain. Shortness of breath is another one. Shock, unconsciousness. We'll come on to shock in a little bit, in a bit more detail. But unconsciousness is, well, all down to you just not having enough oxygen contributing to your brain. So that's another option of that. Any sort of difference after a dive that you wouldn't normally expect. So like I said, any rashes that you don't normally get, any pains you don't normally get, is an indicator of decompression illness. Tricky one with decompression illness is the signs and symptoms. Not only are they very wide ranging, as you can see by the long list that we've got today, but also the signs and symptoms can appear from literally the second you hit the surface to hours or days after you've gone out of the water. I was doing some, I think it was advanced diver training a couple of years ago, and I did the training, got out, it was in Stony, got out, went home, slept, next day got a phone call from the instructor asking if I was feeling all right. I was like, yeah, no problem. Why, what's wrong? It turns out the buddy who I was diving with was currently in the chamber because they had gone home feeling fine and then collapsed. They called an ambulance, found out they were a diver, and then took them to the decompression chamber, and they were bent from doing that training. But it had taken hours for that to turn up. So it's quite important that you know that can happen. The other important point with this that isn't on the slides is just because you dive within the computer or the table limits, it doesn't totally eliminate the possibility of you getting decompression illness. They are a generalized thing that isn't specific to each person. You may be more or less susceptible to it. So just because you've abided by your computer or tables doesn't totally rule it out. Sometimes people get decompression illness and go, well, it can't be decompression illness because I stuck to my computer, and then they rule it out and try and look for other causes of it, and then end up getting in more trouble than they would have otherwise if they had realised that computers and tables aren't a guarantee. So how do we actually treat this? First things first is we want to lie that casualty down. So the whole objective of the first aid with decompression illness is to reduce your cardiac load. So trying to reduce the amount of blood flow that you have, the amount of pumping your heart has to do, the amount of effort your body is undertaking. So you want to lie them down because, well, why? Why would you want to lie them down? Anyone got any guesses?
They're relaxed.
They're relaxed.
So the heart doesn't have to pump like up towards the head.
Absolutely. So your heart doesn't have to overcome gravity is the main reason. But also, like Kev said, you want to keep the casualty relaxed, calm and quiet. Yeah. So you don't want them to be panicking. You don't want them to be exerted by standing up. You want them to be as relaxed and unexerted as possible, because that slows your heart rate and that slows the blood flow. The reason we want to slow that blood flow is if there are bubbles in the blood, you want to try and avoid them reaching vital organs like the brain, particularly the brain, because that's a really nasty one. So you want to try and slow down the travel of those bubbles as much as possible. And if you're bouncing off the walls, jumping around, panicking, you can knock those bubbles, dislodge them, move them around your body more quickly and cause yourself more injury. So once we've done that, we want to administer 100% oxygen. The reason we do this is because it increases the nitrogen pressure gradient. So we know that the air we breathe on the surface is what percentage of nitrogen?
79.
79%. So if we then start breathing 100% oxygen, that means we have 0% nitrogen in the gas we're breathing, which massively increases the pressure gradient from our body to the gas we're breathing. And so nitrogen bubbles and nitrogen gas in our body are going to dissolve into that gas or come out of our body rather much more quickly than if we were just breathing air. So that's part of the reason we want to do that. Another reason, which they've kind of put them in the wrong order, another reason is because if we have restricted blood flow to the tissues, we want to try and maximize the oxygen content of the blood that does get to those tissues. So a higher increase in oxygen increases the content of oxygen in the blood, and then the little amount of blood that does actually get through the restrictions then has more of an effect on maintaining the tissues that it gets to. Moving back to that previous point, where you can use 100% oxygen. If you don't have 100% oxygen, any increased percent of oxygen will help. So there's two main sources that we can get increased percent oxygen. Apart from Kev, anyone got any ideas? Because I know Kev knows them. Kev uses some, or one of them.
Yeah.
It's a little hint.
Nitrox.
Any guesses? Nitrox, absolutely. So nitrox is a high percentage of oxygen than air. Obviously, you have different mixes from kind of 27 all the way up to 50%. So that has a high percentage of oxygen in it, and that's going to help you. It's not ideal, but it's better than nothing. Where else? Yeah, where else can we get a high percentage of oxygen from as a diver? What other equipment could provide us with a high percentage of oxygen?
I'm not going to tell them that one. I know that one.
Rebreather, absolutely.
That's it.
So those who know how rebreathers work, they have a pure oxygen bottle usually. So you can normally set a rebreather in a manual mode to deliver 100% oxygen if you want to. Would you want to deliver 100% oxygen, or would you want to deliver a slightly lower mix to conserve that oxygen, or what? What would you do? Any guesses?
Better to have 100% so that you can use up that 100%.
Absolutely. So better to have 100% because that's going to make more of an effect than 50% for a longer amount of time. You want to try and get that nitrogen out of the body as quickly as possible. So if you can have a higher pressure gradient for a shorter time, that is better than having a lower pressure gradient for a longer time. So if you have the option, increase the oxygen content as much as you possibly can. That goes again for if you're on a boat and you only have a limited amount of oxygen and you feel like you're going to run out before you get to shore. It's better to deliver that 100% oxygen for a shorter amount of time and run out than deliver a smaller percentage of oxygen to try and make it last for the boat journey. So that's an important point that isn't actually covered in the slides. And then on top of all of that, you want to treat the casualty for shock. So shock is something that they've very unhelpfully put at the end of all these slides, but we will come on to it. And you'll see why we want to treat for shock when we get to those slides. An important thing that they haven't mentioned on here actually is do not raise the legs for the casualty. So again, it's coming back to reducing that cardiac load, reducing the movement of blood. We want to try and keep blood as stationary as possible. Obviously it's going to move, but try and slow it down. So raising the legs is going to push blood towards the head, and we do not want blood to go in towards the head at that point. So it's one of the few times where you won't raise the legs. Now, normally when you're treating for shock, like we'll explain in a bit, you would raise the legs because shock is a reduction of blood pressure in the brain. But in this particular case, you would not raise those legs. The only treatment for this condition, the only long-term treatment, is evacuation to a recompression chamber. If you have decompression illness, you need to go to a decompression chamber. It doesn't matter whether it's severe, whether you feel bad, whether you're fine, you need to go to a decompression chamber. Plus, sometimes that means you get a free ride in a helicopter, which is pretty cool. So, moving on to the next thing, burst lungs. We all know the number one rule in diving is don't hold your breath. So, the reason we get burst lung is if you have physical damage to your lung tissue from overextension, i.e. overpressurization, which you get from holding your breath and going up. So two different styles of damage from collapsed lungs. First is collapsed lung, like this. I'm not going to try and pronounce that, but it's essentially where you have gas trapped in between your rib cage and your actual lung that has been punctured, so you're leaking gas into the lung cavity. The other option,
pneumothorax, by the way.
There you go. Thank you, Amy, for doing that, because I would have messed it up. The other option is bubbles between your organs and tissues. Can you pronounce that, Amy? Emphysema. I'm going to have a stab at.
Yeah, you're right.
Both.
It's emphysema.
Yeah.
Right, okay.
So both of these types can occur on their own, but also possible to happen at the same time. Does anyone know what an air embolism is? Anyone at all? Even Kev?
I'm trying to think of it. I can't remember it now.
So your air embolism tends to be air trapped in a tissue. It's very common around the shoulder collarbone area. It's slightly unnerving, but
it sounds like bubble wrap when you
absolutely press. Yes, absolutely, Kev. It's coming back to you. So if you press on the collarbone area, you'll hear something that sounds like bubble wrap, and that's you popping bubbles of air in the person's tissue. It's really not pleasant. It can also affect your voice box as well. I think they're covered on this next slide. Let's see. Yeah, here we go. So signs and symptoms. So obviously it's going to be slightly painful having a popped lung. You can also get bloody froth. So when you damage the lung tissue, you can get blood coming across that boundary in your air sacs, and you'll get kind of blood coming up your throat. It looks like a classic horror movie. That can cause issues with breathing, obviously. So be ready to do some CPR. Fairly obvious it's going to cause some shortness of breath if you've only got half your lungs working. But coming back to what I was about to say, changes in vocal tone is quite a common symptom because your voice box, which is in your throat, can then get squeezed, pressed, damaged in all sorts of ways by this air embolism. So if you hear someone speaking particularly high pitch or low pitch, or they sound different in any way, that's quite a good indicator of having an air embolism and a burst lung. And then shock. If someone's had a trauma like this, it's going to put them in shock because their body will react. We'll come back to shock in a couple of slides. And if you're really unlucky, unconsciousness and death can follow this. If your lungs are damaged and you're not getting enough oxygen to your tissues, that then results in unconsciousness and then death. So this is something that makes burst lungs particularly difficult. The signs and symptoms of burst lung are also similar to decompression illness. So how are we going to differentiate between the two? Do we really need to? So let's have a look at how we actually treat burst lungs. So first we're going to lie the casualty down. We're going to keep the casualty quiet. We're going to administer 100%. Oh, you're noticing a pattern here. This is all coming back to us. So just very quickly to cover why we give 100% oxygen in this particular case. So we want to assist in reabsorbing nitrogen content from air. So this basically, when you have bubbles forming around your lungs, they tend to be nitrogen. And so if you're administering 100% oxygen, that'll again increase your pressure gradient and increase the speed at which that is redissolved and taken out of your body. The other reason is you want to try and maximize the amount of oxygen you can get into the blood through the one working lung you've got left. So if you've damaged one of your lungs, you're going to massively decrease the effective lung surface area for gas transfer. So you want to try and give it the best chance it can to supplement that with oxygen. And then treat for shock. This is an interesting one. So just before we get onto this, are we all noticing that this is all exactly the same treatment as we do for decompression illness? Which means when your symptoms are the same for decompression illness and a burst lung, it doesn't really matter whether you are able to differentiate between the two because the treatment is the same. Leave it to the medical experts to figure out whether it's burst lung or decompression illness. The only difference here is this red bullet point. Recompression chambers, obviously it's not going to help them in terms of decompression treatment if they've got a burst lung, but if you use decompression chamber to deliver a higher partial pressure of oxygen at a higher pressure, it will help them. So in either case, it's normally a good idea to take them to a recompression chamber. So it's just an interesting little side point there. Okie dokie, near drowning. So this is a fun one. Cause of near drowning, no guesses for this. you start breathing in water. Signs and symptoms of near drowning. Circumstances. So if you see someone at the surface splashing around, clearly struggling to stay afloat, there is a good chance that they're going to have near drowning. That doesn't necessarily mean that they're unconscious. It just means that they've inhaled water that disrupts the respiratory process. So no breathing is a good symptom of near drowning. That tends to happen. You also have cyanosis, which is where your skin appears kind of blue and grey. That's a reduction in the oxygen content in your body, so obviously an interruption in your lungs. A weak or absent pulse is another example of this. Basically, your body starts shutting down. So what are we going to do about it? If we are not breathing normally being the main word, we're going to start doing rescue breaths. If we can, oxygen enrich these. The benefits of that really is, as with the other injuries, increasing the oxygen content in the blood is going to help you survive. Just like that. If required, chest compressions. Most of the time you'll need to do chest compressions if you're doing rescue breaths. And then once you've got them breathing again, get them in the recovery position. This is the fundamental point. Evacuate to a medical attention, regardless of whether they appear fully recovered or not. So often in these cases, you'll get someone who has near drowning, whether they lose consciousness or not, they'll get out, cough up a bit of water, clearly in a lot of distress. In a couple of minutes, they'll calm down. They'll say, I'm fine, I'm fine, I'm fine, I'm not dead. And you'll go about your day. What you don't realise is there's something called secondary drowning, which is where the lung tissue, because of that introduction of water and the resistance that water offers to your lungs, it can cause serious damage to the lung tissue. This only shows itself once it starts producing fluid. So your lungs actually start generating liquid in its own lungs. And then this can cause something called secondary drowning, where you literally drown in your own bodily fluid. This can take hours to show up. So, like I said before, someone could get out, swear they're fine, go home, and then just drop dead in that evening because they have secondary drowning. Their body has produced a liquid to try and protect the lung tissue, but it's actually ended up just causing them to drown in their own bodily fluid. So that's quite important. It's something called an edema when that happens. And that's why when we have a near drowning case, we always take them to a medical professional, because they're able to check for that condition and make sure that they're not going to have that complication. And if they do, they'll just keep them in hospital until it happens, and then they'll be able to help them. So finally, we're going to get onto shock. What is shock? Shock is where you have inadequate supply of blood to tissue, specifically your brain tissue. Generally, it's present in all injuries because the body reacts to injuries by reducing the blood flow. The theory is that bodies know that if you get injured, there's a good chance that you're bleeding, and so reducing the blood pressure reduces the bleeding, and that helps you survive. The mechanisms for this, of how it works: reduce blood volume. So you could cause shock by reducing the amount of blood that you have in your body by either a severe bleed. We're not talking a small graze on the knee, we're talking arterial pumping bleeds. Burns, which can actually remove blood from your body, and an edema, which we just mentioned before. Another mechanism is massive dilation of your blood vessels. So this is when your blood vessels increase in size significantly. This can be in reaction to a couple of different factors, but one of the main ones is your body trying to prevent excess bleeding. Some people are particularly susceptible to this. It's a trait that you're born with. Some people aren't. But also you can have cardiac input. So heart attacks can cause a lack of supply of blood to certain tissues, and then allergic reactions as well. So you can have drugs, food, stings, all sorts of stuff that can cause a reduction in blood flow. Signs and symptoms of this: you get weakness and dizziness, sweating, rapid pulse, rapid breathing, unconsciousness. I mean, the list is quite extensive. It's all what you'd probably put down to as fainting. People looking a bit clammy, having a fast heart rate, bit dizzy, sometimes actually unconsciousness. It almost looks like just they're about to faint is probably the easiest way to describe this. So how we deal with this. First things first is we treat the prime cause of shock. Shock normally doesn't happen by itself. It's normally caused by something. So whether that's decompression illness, whether that's a massive trauma to a leg, an arm, a limb, a large bleed, we want to treat that first. So we want to stop the bleeding. We want to try and deal with the decompression illness first. Then after that, there's not really much we can do for shock, and apart from just let it sort itself out. So we want to just make sure the casualties feeling okay as they can be. Try and keep them calm. Now this is a slightly tricky bit. You want to lie the casualty down to try and increase the blood flow to the brain, because that's the thing we're really worried about, and raise their legs, with the catch that if you're suspected DCI or burst lung, you do not raise the legs. So if you suspect DCI or a burst lung, don't raise the legs. In any other case, raise the legs. So that's a tricky one that you will need to remember. You want to keep them warm and comfortable for obvious reasons. It's not nice being cold. Administer oxygen if you can, because that increases the oxygen dissolved in your actual blood and then tries to offset that effect of reduced circulation. You want to monitor the condition as well, because they can deteriorate, they can improve. So it's something to keep an eye on. And then this is an important one. Don't give them any fluids unless they have DCI. Fluids essentially bar them from having any sort of surgery or medical operation. Anyone who's had a surgery or an operation knows that you're not allowed any fluids or food for a certain number of hours before doing it. So don't give them fluids, particularly if they've had a trauma, like a cut or a limb being damaged, because you'll tend to get surgery in that case, and then you really don't want them having to wait for that surgery. The reason for this is sometimes people throw up in surgeries and kind of drown on their own vomit. So don't give them any fluids unless it's for DCI, where fluids help improve DCI. So that's the one exception. And then evacuate for medical attention. A lot of these, you don't just want to ignore it. You want to actually try and get some help, even if the person guarantees you they're fine. Going back to that first point on DCI, with denial, people always try and convince you that they're absolutely fine, there's nothing wrong with them, because they just don't want to believe that there's an issue. So, final case of shock, there's a slightly unique one called immersion shock. So this is a really extreme form of blood vessel dilation. So when you are, this tends to happen with people who are lost at sea, where they've been in water for a long period of time. Your muscles tend to relax in the water because the water provides buoyant lift and kind of supports your weight all around your body. So your muscles relax because they don't need to support your weight at all. And then that means your blood vessels dilate because there's nothing squeezing them and making sure they're the right diameter. Once you get removed from that water and there's nothing supporting you, your blood can pool in your lower limbs, especially if you stay upright. And then obviously if you've got lots of blood in your legs, you haven't got much blood in your head, and your head's kind of important to have blood in. So you want to make sure that you keep casualties horizontal all the time. So if they've been in the water for a long time, keep them horizontal, because then the blood will disperse across the body evenly. Try and discourage any movement or activity by the casualty, but that's kind of goes for all the other illnesses as well. This one's particularly nasty. There was a couple of cases a while ago where people were lost at sea, they were found, and then the Coast Guard would try and pick them up with a helicopter. The winchman would come down, talk to the casualty who's just floating in the water, perfectly fine, bit cold, but they're fine. Check they're all right, clip them up, start lifting them up to the helicopter, and by the time they're at the helicopter, they were dead because they had immersion shock, and when they got pulled out of the water, all the blood in their body just dropped into their feet, and then they had literally no blood supply to their head, and they just died on the way up to the helicopter. So now they use a special type of harness that keeps them horizontal, so that's not an issue. But it just goes to show how quick acting this can actually be. I think this is the last one we're covering, carbon monoxide poisoning. So I'm expecting an answer for this from a particular person. What causes carbon monoxide poisoning? Where are we going to get that from? There we go. Kit officer pipes up eventually. Breathing gas contaminated carbon monoxide. Why would we have carbon monoxide in a contaminated fill? what could cause that?
If you keep the exhaust, like the intake too close to the exhaust, the compressor.
Absolutely. Anything
Yeah,
else?
but
Or have it near a car giving out exhaust as well.
Yep. Any sort of fumes near the
Yeah.
intake is really bad. There's another one that I'm thinking of.
An out of service air filter.
Out of service air filter, absolutely. So that won't stop all the oils and the water and that sort of stuff. So you could get stuff coming through there. There's one more that I'm just thinking of. Can anyone have a guess? No? Okay. So if a compressor overheats at all, or it's out of its service life, the oil in the compressor can actually break down and produce carbon monoxide. And so you actually end up with contaminated fills where your air intake is totally clean, but the compressor itself introduces the contaminant. So you've got to be really careful of that. The effect of carbon monoxide is particularly nasty because it's really, really reactive with your hemoglobin, which means if you have lots of carbon monoxide and lots of oxygen, the carbon monoxide is the thing that will bind with the hemoglobin. Once it's bound with that hemoglobin, the hemoglobin cannot absorb any oxygen at all. So it basically just kills your red blood cells. Like that. And there's also evidence that it's actually a poisonous effect as well as hindering hemoglobin oxygen intake. So it's actually kind of a double whammy as well. Signs and symptoms of this: headache, pale greyish appearance, weakness, dizziness, nausea, tunnel vision, vomiting, general signs of a lack of oxygen. So there's a real list of stuff here, which makes it really difficult to pin down. If someone is acting funny, carbon monoxide poisoning isn't always off the table, especially if there's multiple people complaining of symptoms, because that tells me that the fills are contaminated. There's another symptom that they haven't listed, and they say they've taken it off because by the time you see it, they're basically already dead. It's when you have really, really red lips and nail beds, because that means the hemoglobin has totally bound with the carbon monoxide and turns a really bright red. And so if you see someone with red lips and nails, you know that they're in a serious amount of trouble. Most people, when they're at that stage, are basically already dead, to be honest. So that's why they've taken it off, but I thought I'd mention it. What are we going to do about it? I will give you one guess to tell me what we're going to do. Go on, someone guess.
O2.
Oh, you are good.
Oxygen.
So we remove them from that breathing supply. Obviously, we want to lie them down with the legs raised because we want to increase that blood flow to your brain, and administer 100% oxygen. Again, oxygen is transported in the solution in the plasma. So even if your hemoglobin is rendered totally inert, your plasma is still able to transport a small amount of oxygen, and that might just be enough to maintain your tissues until you can get more help at a hospital. It does actually help breaking down the hemoglobin that's being combined with the carbon monoxide as well. And it helps restore normal cellular function. Obviously, oxygen tends to do that. This is another one where a hyperbaric chamber treatment is quite useful because of the high partial pressure of oxygen. So that increases your pressure gradient again. So if you have a really severe case of this, a hyperbaric chamber, deco chamber, isn't a terrible idea. Cool. So that's pretty much it. As you can see, oxygen administration is pretty much beneficial in every single case. 100% oxygen is the best thing to use. And if you have the choice, use it quick and high percentage rather than a low percentage and for a longer time. You want to try and administer that oxygen as early as possible, because that's the thing that really matters, trying to get it at a high percentage as quickly as possible. And oxygen tends to be a supplement for other first aid. So you'll see as we go through that PowerPoint, you'll do stuff like put people in the rescue position and put people in CPR, rescue breaths. So you do it at the same time as this. So in the practical session, we'll actually practice using oxygen admin alongside rescue breaths. So there's certain tools that we can use for this. And then after every sort of injury as serious as this, you always want to try and take people to medical help straight away, and whether they seem like they've recovered or not, because there's a lot of conditions which hide for a couple of hours and then spring up and can cause people to die kind of unexpectedly. So, any questions about any of that at all? Dead silence again. That's lovely. Cool. Okie dokie. So that's that lesson. In terms of the practical side of this, we will try and get a room booked at some point, and we've got an O2 kit which we'll run through with you guys on how to use. It might be slightly interesting with COVID, but we'll see what we can do. And I think that's really useful to kind of see the real life application of the theory that you've just looked at then. So if there's no other questions, we'll stop there. And the instructors have got a bit of time before the start of the next lecture.